Hello all, welcome to our session today. I'm just going to get started, although we probably will have people joining us. I am Sheena Arthur, Partnership Manager for Health and Social Care at Glasgow Council for the Voluntary Sector. Delighted to have you all here. We are using Zoom, and please feel free to use the chat, the little icon at the bottom of your screen. You'll have been muted so we don't have background noise, but you will be able to participate and unmute when we get to the discussion bit. I'm not multitasking very well here. So we really appreciate your time and want you to get the best from the session. So please participate as you're comfortable. As Lynn has put in the chat, we are recording the first bit of the session, and we will stop recording after Pennie's input. We want to get that and be able to share it, but for the discussion and questions, we want you to feel free to, to contribute and have discussions, so we won't be recording that bit. And this session is very much about reflecting on the discussions we've had in the last year or two, our World Reimagine sessions, and we really wanted the chance to reflect and go over what we've heard and really sense check with you what we've heard as well. We've also got a part of the session relaunching the Health and Social Care Network. So we'll have a little bit of a break just before that and then have a short discussion about that. So there's two elements to our session today. Delighted we've got Pennie here with us, who I'll be introducing shortly with our Your Voice Has Power t-shirt on. How very appropriate. So thank you, Pennie, for being here with us. Before we start, I really just wanted to acknowledge everyone's contributions and commitment whilst we are living through and in this pandemic. And I was really thinking about that before the session, that we're not getting a break from this. The pace is fast and it's not letting up. And lots of you have multiple responsibilities in this. And it's really appreciated, your time and effort, and I really can't say that enough, how everyone's working and living in this situation and doing the very best they can. So I really wanted to acknowledge that. And last year we facilitated many events, and there was some amazing sharing of experience and expertise, and we learned a lot, and we're looking at our learning about how we can be more inclusive, have greater participation in our events, and also how we can value the contribution, particularly of people who are contributing to our sessions who are not paid. They're either service users or carers, or they're unpaid, or they're volunteering their time, even if they're in a paid role. So we're really trying to look at all of that. And we heard a lot, some strong themes and difficult things to hear. And we've heard things that we think we want to focus on more in the year ahead, but really want to check in with you that we're focusing on the right things. And some of those are about inequalities, some are about the role of the voluntary sector, the role of carers, informal support. We've had the independent review of social care, the Feely review, we've had the consultation, and I really want to thank Lynn for all her work last year in responding to the consultation and really bringing all the thoughts and voices that we heard in those sessions together. That was a huge job and really appreciated, and really emphasises when we have these sessions, we're doing something with what we're hearing, and we want to do more of that in the year ahead. Also, we heard a lot about power, back to Pennie's t-shirt, and the distribution of power, and that's a real strong theme. We heard about, the need for public bodies to let go, to say yes more, and how do we build trust and the importance of that. We heard about trust and how eroded trust has become, and that's a real key issue for me as a partnership, in a partnership role. How do we do that? So we want to reflect on lots of things, and we thought, who better than to ask Pennie Taylor to join us, because Pennie led our World Reimagine sessions in 2020, and many of the sessions she chaired in 2021. And I'm getting nervous just thinking I'm getting to interview her. So I'm hoping someone can virtually nudge me if I get tongue-tied. But we thought, what an amazing perspective, because Pennie's in amongst all of these themes. She's interacting with health and social care issues and with everyone involved in it, but she's not attached, if you like, to one organisation or one department. And I think that's really key, because no matter how committed we are, how passionate we are, how good we are at what we do do become embedded in a culture, in our way. You know, we probably all think our way is the best way. And so we thought this was a really great opportunity to have Pennie's reflections on all her discussion and what she'd heard, and really to support us, I think, in that objectivity and trying to move things forward. So I'm really delighted we've got Pennie here. Also, I'd like to acknowledge we've had great conversations, and partnership, relationship building is still a priority. It's an ongoing priority, but I really want to be thinking about, what are we going to do? What's the action to go with these really great conversations in this year ahead? I'm not expecting that Pennie's going to have all the magic answers for us, but really want to welcome Pennie here as a journalist, broadcaster, health and care specialist, just an amazing woman we have in our midst, and I think a champion for our community and what we're trying to do. So I'm really delighted to hand over to Pennie, and hope you all enjoy this session, and look forward to, please use the chat for questions as we come into that later.
Thanks, Sheena. I have to say, I'm really nervous sitting here in this position. I'm not quite comfortable asking the questions, but thank you very much for the opportunity to really think from this perspective at this moment in time about where we are. And thank you also for giving me the opportunity to wear a t-shirt that I bought really many years ago and have never had the chance to wear. But you'll see that it's really relevant to my reflections on how we got here, and, you know, where, in my opinion, we should perhaps be heading. So yeah, I've been a journalist for decades covering health and social care in Scotland. And I have to say, like everybody else, we've never seen anything like this. Yeah. The challenges, the hospital waiting lists, for instance, which is where journalists' minds jump when you think about the challenges. But I think what the pandemic brought into such stark focus is the crisis in social care. And to me, it's a statement of the blindingly obvious that if you don't have a functioning social care system, you cannot hope to have a functioning healthcare system. The two are absolutely intertwined, and I'd chuck housing in there as well as a kind of third important plank in what we need to be thinking about, what we have been thinking and talking about through the GCVS. And despite, I mean, like you, the background news, watching what's unfolding in Ukraine is so overwhelming in its magnitude that I suppose I've also welcomed the opportunity to consider something that's vitally important to us here at this moment in time in Scotland. But I think all our hearts go out to people very close to here having such a hard time. COVID. So we talk about recovery from recovering health and social care services, yeah? But I don't know about you, but I have a very strong suspicion. My journalistic nose is twitching and telling me that it is absolutely not gone away, the pandemic. It's here. It's probably here to stay. for a really long time, and recovery therefore is going to involve a very long haul. But I think one of the key messages I've heard come across from the discussions I've been having that the GCVS has hosted is that there is really important stuff in Scotland that we need to address now, and that we can address now if there's a will to do so. The GCVS, through Our World Reimagined, that series of discussions, which, you know, adds up to many hours of rich thought, gave me a lifeline to hang on to during those waves, the first waves of the pandemic, as visions of how we can embed real change, change that's not just sticking plaster. And frankly, reflecting back on my 30-odd years of covering this agenda, there's been a lot of sticking plaster. And now's the time really to get underneath that. But that's going to demand very different behaviours from the traditional power bases. And Sheena's absolutely right. Power has been a theme running through these discussions. How to make it more equal, how to share the resources that we have more equally and in a way that suits more people, for the large organizations, the commissioners, to genuinely join hands with community organizations and do it differently. So Derek Feely's report, the Independent Review of Adult Social Care, marked a point, a recognition that we knew long before the pandemic that somebody had to do something about social care, but it's always fallen into the too difficult pile and been kind of repeatedly kicked into the long grass, which is why we found ourselves where we found ourselves. Feely's report was incredibly refreshing, and I think published as the pandemic was starting to unroll, and it really chucked a big cat among the pigeons who have been quite happily kind of sweeping up the corn for themselves for a very long time. The feathers are still flying, obviously, behind closed doors while we try to work out how to square the interests of the power bases. But I think we've heard outlined what they need to address, and it's things like inequality. You know, Scotland, life expectancy in Scotland is falling for the first time in modern history. Something is going badly wrong here. There's lots of investigation into it, and indeed the Health Foundation's just announced it's going to do an independent inquiry into inequality in Scotland, which will be really interesting. But once again, we have to act. There are going to be loads of inquiries into what happened during the pandemic, but I don't need to tell you that, you know, a major issue is human rights and infringements of said human rights among particularly disabled people, people living with chronic illnesses, their carers, a vast army of people, and things like withdrawn support that hasn't yet been reinstated. Why not? Yeah. Why do we still have family carers and friendship carers struggling on alone without the support they need? There's urgent stuff we need to do now. Yep, it needs money, and it's good to hear that there might be money behind the thinking around the National Care Service. But as Sheena said, it's what you do with that money that matters. Yeah, it absolutely. And this is the golden opportunity to harness the energy and the voices of the third sector, of community-based organizations in Scotland, and genuinely do it differently. I wrote a blog for the GCVS where, you know, I kind of like imagined what it could all mean. if we could reframe, as the Feely report calls for, reframe the status of social care in our society. If workers, if care workers and people delivering care were held in the esteem they deserve, and that the COVID pandemic shone such a spotlight on, if people were paid enough to acknowledge their importance to the whole system, if public sector procurement was focused on local communities and job creation and supporting local businesses in buying products and services instead of shipping food up, say, from Leeds. And if co-production were embedded across public agencies, I think we would see a real sea change, both in the future and absolutely now. There are huge challenges we've all got to solve as a society. Environmental impact, rarely comes into the conversation, but absolutely vital. What can we do to, as well as address the needs out there, consider impact on our environments? Digital technologies are here to stay. Person-held records hold out all sorts of interesting prospects. Inclusion, the fact that so many of us can join one talk on a rainy Monday afternoon without leaving home. There have been benefits that we mustn't lose sight of. But core to all this is embedding co-production, making it a reality, moving it from being the rhetoric that I've witnessed over the years. Imagine if well-being were the targets that were built into measuring the performance of our systems, and that instead of firefighting solely, we could also, because we're going to have to firefight, get in about thinking about prevention. No longer can it be regarded as a nice to do. It's absolutely essential to where we go from here. And at that point, I'd kind of pull it to a close and open it up to any comments and questions. We haven't touched on the media, the voice and how to use it, but I've loved hearing the voices of this constituency over the past 2 years. You've kept me going, people.
Oh, thank you, Penny. You've kept us going as well, asking questions and getting us thinking. Thank you so much. There's a bit of discussion going on in the chat, Lynn's sharing information of things that you've mentioned, and some strong themes coming through. I know people will have questions, but I'm just going to kick us off, if that's okay, with a question around, so you mentioned, the inequality and the imagining this vision of how things could be. And I was really struck. I was at an event on Friday. The Glasgow Disability Alliance launched their report on the triple whammy, the effect on women with disabilities and COVID. And it just struck me, the inequality that some, this has been a really challenging time, but some people have been much more effective than others. And as you said, we're still living through this. And do you think that, our government nationally and locally are ready, to face those inequalities, and the challenge, that the Feely Review talks about that inequality, about people being involved. But for me, there's something about acknowledging just how deep that inequality is. Do we need to do that before we can work through, or, I'm asking you lots of questions at once.
Yeah, I mean, it's a really important issue. And yes, I think national and local governments do acknowledge the existence of the inequalities. It's politically, it's really quite difficult, isn't it? Because you have to concede that this is happening on your watch. You might have reasons that you think that it's happening and that you don't have any control over it. But it's really tricky one, isn't it? Because we're seeing We're seeing drug deaths, for instance, at the highest levels ever. And this was before the pandemic. I wince at the thought of the impact of the pandemic on already world-class inequality levels in Scotland. I think national and local governments would love there to be a simple solution. But you're back to entrenched power bases, the way things have been done, and empires, and how those empires interact, which is what we're watching go down, I think, in the deliberations around the National Care Service. What the Feely report fundamentally called for was quite radical change, and I personally think it's going to take radical change. More of the same isn't going to deliver anything except more of the same. And the Feely report, in its suggestion, having listened, really listened to the voices of people directly affected, concluded that the traditional holders of the purse strings have to give up those purse strings. Now, it's going to be very telling to me when we see the outcomes of the deliberations around the National Care Service, whether that particular piece of advice has been taken on board. Because if it isn't, I do wonder how we can drive real change. I'm open to persuasion otherwise, but that's my suspicion as it sits today.
Thanks, Penny. And I think that's such an important point about how we move on without it feeling, you know, that there's a blame, that there's a responsibility, and things have happened right here, right now. But how do we get to the, you know, that we're in this together to create a change, because it needs to change, doesn't it? And the work I'm doing, we're certainly talking about that how do we get from a them and us to an us, you know, that we can. And I think power is, I'm busy reading a lot about power and how we even acknowledge it before we can change it.
Yeah, it runs deep, it goes really deep, it underpins everything, doesn't it? Our interpersonal relations, the whole lot. But you know, it's things like, you know, competitive tendering for care services. Yeah, it's whether that is sustainable as a model for going forwards in the future. If we're going to be talking about co-production, cooperation, what kind of framework underpins this? Yeah, now we've heard a lot from people, we've heard the views of people, and I really, really, really hope they are taken on board, because it's incredibly complex. This is why it's not been sorted out before now.
Yeah, thank you, Penny. I'm seeing that Lorraine is patiently waiting with her hand up, so I'm going to invite Lorraine in if she has a question. Thank you for waiting there, Lorraine.
That's okay. Thank you so much for taking my question. Thank you, Penny. I really enjoyed your presentation, and what you say is just so true about everybody working together, co-production, etc., etc. I think one of the biggest problems for local authority and for the government is complete lack of trust that we as carers have in their systems and their listening skills. And I would like to see the National Care Service being really looked at by service providers and people who know what's actually going on in the world, people who have an understanding of different conditions, people who have different levels of need, etc., etc. And I just feel that I took part in one of your GCVS things before, and although, you know, I had a chance to speak to the new Health and Social Care Minister, Kevin Stewart, And he listened, yes, he listened, and he had some great things to say. But I feel as if we've been down this route before, and feel very, very disappointed in all politicians, I have to say. I think that they're not going to make this a successful venture unless they have carers at the core and also providers. And as you say, local authority and governments are so entrenched in traditional ways of doing things. I think that's a huge, huge barrier to overcome. So I think that's all I can say at the moment. Thank you so much.
Absolutely, Lorraine. I really hear you. You know, I think the formation of the new National Care Service, if it gets it right, ought to allow for your vision to, you know, be more of a reality. I was shocked, for instance, when integrated joint boards were first formed, that while carers could sit in on meetings, they couldn't contribute. They weren't heard. I mean, it's like crazy. And there was, again, that's one of the recommendations for change, is that the, you know, whatever they're going to do with IJBs, that people with direct experience are heard. Now, I share your cynicism that the acceptance may be grudging and slow, but you know what, we've actually possibly got a chance. I really would hope that we've got a chance to encourage those organizations to really embrace it. Don't know about you, but you know, in the chat around the NCS, I've been really impressed by, it sounds again grudging, but the acceptance that the voices of experience must be heard. Yeah, there's an advisory board. I saw that there's a question come in: is there a third sector representative or unpaid carer or citizen in Mr. Stewart's National Care Service? I don't know on the executive management team, but I do know that there is a panel of people that he listens to, that he met through events like Our World Reimagined, and people that have been engaged in that process. And I would hope that it isn't just rhetoric, that they really are heard. You know, when we talk about the politicians and stuff, I'm increasingly wondering how this growing movement that I've seen developing through the pandemic, this movement of people that care about social care, you know, I think, how do we become politics too? How do we shape this and drive it? And I suspect it can only happen collectively, that we've got to come together in addition to the great ways that exist already, maybe new ways, not to let the voice disappear into the background again, to keep it at the top of the agenda. Now, we can talk about media and how you do that as much as you like if you want, but I think it's about maintaining the momentum. I want to keep a sense of hope that we can really drive change, that these aren't empty words, that we can make it happen.
Thanks, Pennie. You're reminding me of, after some of our events, they're so energizing, and there's all these amazing people, like Lorraine was talking about, you know, people contributing who've got real life experience of the system and how it impacts their life and the decisions that they maybe don't have a say in. And it often strikes me all the amazing people we've got in this mix. So what is it that's stopping us creating the change that we want? What is that change? How can we make it happen?
Well, I think it's a really big ask, because you're asking people who already face daily challenges in their lives to get involved and to stand alongside you and to join, you know, which is something that's always framed as a fight or a battle. I'm uncomfortable using those words at the moment, and I'd like to use maybe different language. And maybe that's a separate conversation. So it's a really big ask, because as those of you know that are activists in this field, you can sometimes feel like you're banging your head off brick walls. How do people support one another when, you know, there isn't a fee attached? You'll sit around tables with people that are on very high salaries who are being paid to give their time there, yeah? And then a really important voice that needs to be around the table is expected to do it all for free. Maybe that's a really big issue. But on the other hand, you wouldn't want to necessarily professionalize the genuine, heartfelt input of real people out there across the country, be they family carers or, you know, people in receipt of care, care workers. So we need a conversation about how we grow that. But I'm so pleased that there's the passion and the energy that I have witnessed over the past couple of years behind this. And I'd love to think that there would be a way of harnessing that and making it too important to ignore.
Yeah, thanks, Pennie. And I'm thinking about colleagues. Oh, can you hear me?
Yes.
Yeah. I'm thinking about colleagues that I'm working with, and you know, we're all human. We all have a family dynamic. We all live in the community, maybe not necessarily the community that we work in, but what is it? You know, that's the bit that's fascinating to me. What is it that's stopping that human decision making, you know, common sense approach? What is getting in the way of that? And that's the bit for me I'm really every day grappling with, to understand, you know, without sounding like a child saying, come on, let's just do it.
I know.
What's getting in the way?
I mean, that's the billion, trillion, zillion dollar question, isn't it? If I knew that. Whoa. But one of the things that really struck me through the Our World Reimagined series was the talk about community and the need for community development. Arguably, we've all been boiled like frogs, you know, to kind of believe that there isn't such a thing as community. Do you know what? One of the big things that the pandemic has shown me is that when you've got a good community, boy, can they do things, right? So I think it's about energizing, resourcing, targeting, concentrating on community, building it. Bring back, I mean, you know, thinking back to the days pre-Thatcher, you had community development officers, people that made real change and did really exciting things in communities. Then it got politically unpopular and they all got taken away. Hey, let's bring them back. Think of the job creation that could go into our communities, which is where the inequalities lie, if every local commissioning service had a local remit, that it bought its services locally as far as possible. I mean, yeah, obviously, you know, that we started to really reinvest locally. I would think that the win-wins from that would be long-standing, and somebody that knows how to crunch numbers could probably tell me how much money it would save in the long run. We talk such a good game in Scotland about public health and upstream and prevention. If we really mean it, it's about investing now, yeah? Getting in front of these enormous problems like our drugs deaths and getting underneath them. Do you know what? It's not rocket science what causes this. And the work that I've done on it told me that we've plunged into these inequalities because of the effects of austerity. Now that, for me, it's stark, it's clear. I could do it in a sentence, what I believe the causes are. It's what you do about the austerity and your response to real hardship, which we are going into yet again, like we're on a roller coaster. My heart sinks. Somebody cheer me up. I need to hang on to hope.
It's Pennie. I'll add in some hope that in the work I'm doing around maximising independence, we're looking at what works and what's been making a difference in communities. And I'm really delighted some of my colleagues are here in the call, so I'm sure they are listening intently, because we can think about some of these. What are the things that we could test or fund to make a change in a community?
Well, the well-being thing is an interesting one. I've been doing quite a bit of work of thinking around well-being and the well-being economy, which again, you know, featured in our discussions in that series. You know, if you had different measures, there will be people that know how to measure well-being, but, you know, imagine if impact on well-being was an outcome measure that was adopted meaningfully by commissioners, whoever they may be across the board. I mean, I think we could make really quick wins if we just did things differently. Yeah.
Thank you, Pennie. We've got a couple of people with their hands up, so I'm going to invite Martina. Nice to see you.
Hi there, thank you, and Pennie, some really great words there as well, and from Lorraine and others as well. Talking about the hope part, I cover the northwest of Glasgow, and we're a bit like a mini GCDS in some ways. We're a geographical network, and I do quite a lot of work with communities, and there's some incredible work and there's some incredible human beings out there doing stuff just exceptional, day in and day out, not just during the pandemic, all the time. I mean, it's so difficult though, and it's a challenge every day, and they're under-resourced and under-recognised and don't get their feet round the tables. And I put a wee bit in the chat, and I think part of the issue is the language that's used. I think the language of power is an incredible barrier to people getting involved as well. Also, things that we know, they have meetings during the day when people might have care and responsibilities or might be at work or whatever they're doing. They have meetings at times that suit them, and a language and a time that suits them, and in venues that suit them as well. They need to have meetings in communities and accessible venues. When, as I always laugh, I've been involved in communities for about nearly 30 years, and it always makes me laugh. I think the people in power think communities finish at 5 o'clock on a Friday night and don't open again till Monday morning at 9 o'clock. I'm afraid that's not the case for communities. But just to add that bit of hope, honestly, and I'm always heartened and absolutely amazed by the incredible amount of people out there that keep going day in and day out, regardless of who is listening. They're still doing it. You know, and it's just brilliant to hear, and you know, it's great. I wish we could all get some of their enthusiasm and dedication.
Well, you've topped up my hope levels, so thank you very much for that. Before we come back to, you know, those projects and the wonderful work they're doing, I couldn't agree with you more about the language of power. It drives me around the bend, the jargon, which is just about excluding people. I fall into it occasionally myself, just as shorthand, and I don't mind being picked up when I do. I mean, I know it might be controversial in this group, but one of the phrases I really hate is lived experience. What's wrong with experience? You know, it sounds like tautology to me. It's like, well, what's the opposite? Dead experience? Come on, stop making it up as we go along. We don't need more jargon, but it's an unpopular opinion, I have to say. And it's not beyond the wit of anyone to do community involvement properly if you just do it properly and involve the right people and a bit of creativity. It's really not hard. However, it appears to be for some. But back to the hope and the wonderful projects. Now, I want to hear about those, right? I want my social media feeds to be telling me about what you're doing. It used to be the days that you'd want to get on the radio or the telly or into a newspaper. Those days are gone, right? The connection with people, for me, again, it's an unusual opinion, but I love Twitter. I really love the connection it has given me to people I wouldn't have encountered any other way before. The things I learn, the people I've met. You know, I think about Lynn here, who has been a powerhouse on Twitter about representing the views of family carers, and as a result has got herself on radio and telly. But that's incidental, because actually what matters is that you're speaking to everybody directly. So I'm wondering whether there's more we can do to get the message out there that what is happening in communities works if it's got the right resources. And by that, I don't just mean the money, because actually there's a lot more that's probably actually very much more important, like the people. I'd pay good money to read something about that every day.
Pennie, while people are thinking about that, can I invite Jennifer, who's got her hand up and has been patiently waiting while people are thinking about sharing the messaging, and it feels appropriate that media's part of this discussion with you about recovery and how we move forward. But if I can just invite Jennifer in to ask her question or make her comment.
Yeah, I mean, I've come from a very unique position. I was living in London for 13 years, and I came back to Scotland in 2019, just before the pandemic hit. And I have to say, I was so amazed at the community stuff that was going on in Glasgow and all the community gardens. And, you know, I've got memories of my granny living in Scotstoun, and I've seen how those backyards, the tenements, and how they've evolved over the years. And it was just wonderful to come back and just see these gardens and vegetables and the communities coming out. And then to see how the communities all pulled together during the pandemic as well. So I think there was a lot of great work happening up here before the pandemic hit, and then again seeing more. But one of the things that I witnessed down south as well, which I'm sure probably happens up here as well, and on an individual level, and some of the work that I've done, I've seen carers having to get into legal battles to fight for the right to get access to care that they need or a family member needs. And I've always wondered, has there been a bit of work done on the cost of that? I mean, when you look at those individual battles and how much it must cost for one battle, but how much does that cost collectively? And you know, that money could be redirected back to communities rather than individuals having to fight legal battles. And I don't know if I'm way off the mark or if there has been something done, but I do think there is something about that when we look at what the collective issues are, but what are the individual battles that people are having to fight to get access to care, and how much that's costing them in terms of their well-being, but also it's how much it's costing the systems as well. And if that money can be redirected in a better way.
Absolutely. I mean, I don't know the answer to your question. I really don't know what the cost is of the legal battles that people will be engaged in. I'm wondering whether anyone is gathering that information. I mean, very often, you know, it'll be university departments or organizations that are doing that research, but it's absolutely true that whatever it is, it's misspent money by the system. There's a lot of misspent money by the system. You see the same thing, I think, in healthcare too, when people get settlements for things that go wrong. But, you know, it brings me back to this is sort of counter to my instinct as a journalist, okay, because I don't do numbers, I do words. But I'm really interested in the economics of social care. And I wonder how much work has gone on into, for instance, assessing that cost as part of the bigger picture of inputs and outputs, or whatever accountants would call it. I think it would be a very interesting piece of work if it hasn't been done. One of the things that the pandemic really exposed very early on was a lack of information, a lack of good, reliable information about what goes on in social care. The same must be true of its impacts. You know, how do you measure avoided bed days in hospital, for instance. There are very good economists that I'm sure can do it, and maybe we should be speaking to some of them. Maybe we've got some in our audience. If so, please step up.
Thanks, Pennie. I'm just wanting to bring in, there's a couple of comments, maybe thinking about recovery or suggestions for how we can create some change. So one of them, Lorraine's mentioned about sort of shadowing or going into a job role to experience what it might be like for people day to day. And Gordon's made a comment about, you know, some people in the local authority doing that, sort of swapping jobs and doing different things. So there's something maybe, I know my colleague Isla's here from Workforce and Culture, so maybe things we can think about for the future, but also somebody saying maybe media training for, you know, you talked about Lynn as an example of having that voice and engaging, and so how, I'm asking this as the person who's not on social media, so is that, do you think that's something we get more skilled about? I'm thinking we had an event last year and someone was talking about our role at GCVS to sort of amplify the voices, to bring all these people together. So is that, do we need to get more training to be more skilled, more smart at what we're doing?
I would absolutely say, yeah, how can it hurt? But don't forget that that's what you're doing right now. We're being recorded. Do you know what I mean? You're doing it right now. And for me, the most successful delivery that there is, and the people that I listen to and I watch on telly, are the natural communicators. But there are skills. And I tell you what, I think for most of us, it's about the confidence. So you've got the skills, you're using them all the time. Sheena, you're using them superbly right now. It's the confidence to use those skills that I think some of the support that's available out there gives. I don't know, because I haven't done it, but Lynn has done the STV scheme that's, you know, opening up the training to encourage more voices to come forward. But you know, it's not a magic wand. You've got those skills. It's a woman's thing. It's having the confidence to use it. Lynn, you're using it.
I really recommend it. Actually, Martina was talking about that kind of stuff. It's Nicola Kane at STV, and it started out, I think, through work that Talat Yakub was doing nationally. People know who Talat is. So there's been different sessions for women. The last session I was at was disability focused, and then there's one coming up for women again, I think. So it's Nicola Kane at STV. I'm sure if you emailed her, she'd be happy to do it. She'd probably never forgive me for saying that, but yeah, it's honestly, I mean, it was an hour long, an hour session, and I picked up so much from it. It was brilliant.
Fantastic. And is it tips and hints, or is it the confidence that you can do it? Which bit matters?
Both. I think it's both. So they give you a bit of confidence to say, like, you, as you're coming in not as a politician, they tend to be led adversarial, so you get a bit of an easier time. So I would definitely recommend it, Martine and others, if you're willing to be voiced and stuff, then absolutely. And I think it's something we could look at, Sheena. Maybe I think some of the people do raise quite a bit. So yeah, thanks.
Well, it's something I've done in the past. Bear that in mind. I don't call it media training. I call it media awareness, because I don't believe that you need the training to do it. You need the awareness, you need the context, and you need the confidence.
Yeah, thank you. I think that's something definitely we can pick up and take forward. Lorraine has her hand up, so I'd like to invite Lorraine back in.
Okay, thanks again. I think I've got probably too many things going around my head at the moment. There's so many people saying such great things. One of the things you were saying, Sheena, was about people going and taking a shift on, or my concern has always been that the people who make policy have absolutely no idea of what goes on in a care home or supported accommodation, and the fact that support workers all have to be trained in so many different skills, and this is definitely not reflected in their wages. I just think it's appalling. I've been banging this particular drum for many years, and I just don't understand why they don't just bite the bullet and give them a decent wage. We need to give them at least £15 an hour to make it worthwhile. They have a huge responsibility. I don't think the politicians understand that some of the children or young adults that they look after have serious health issues, and these people are doing nursing duties. They have a huge responsibility, as I've said before, and they definitely don't get paid for it. There was something else I was going to say. Oh yeah, it was just about, you know, obviously there's different levels of support workers, you know, because there's people who maybe have a learning disability but are more or less able to cope on their own with a little bit of help. And then at the other end of the scale, we have children and adults with profound and complex health issues. And so there should be a reflection in the wages for that as well. I think it should be graded as nurses are graded. I also just wanted to put in a little bit about PAMIS, who do a lot of training for this particular group of people. And they would be more than happy, I'm quite sure, to deliver some of those trainings to anyone who was interested. So, you know, I've got lots of other things I'd like to say, but I think that's enough for just now. Thank you.
Oh, thanks, Lorraine. Thanks very much. And great, we're getting some ideas and some solutions that we can start to pick up on, which is great. We're going to move on. We've just got 10 minutes left, Penny, not quite. And our theme is really thinking about recovery. And I do find this difficult, this word recovery, because for me there's an implication that we've got through, and I think we're still in this. But I think for recovery we've got some ideas to think about in our discussion here. But any sort of key thoughts on what do we mean by recovery? What are our recommendations or messages? What are the things we want to think about in looking at a process of recovery?
Well, I mean, if you were starting with a blank sheet of paper, you know, again, you could be looking at recovery in a really big sense, you know, upstream, reversing inequalities, you know, be really ambitious about it. And then, of course, what would matter is the action plans that would get you there. I think, though, in reality, recovery is kind of a euphemism for firefighting right now. It's about keeping it together, you know, people, the general public tend, if you were to talk about recovery, they're going to be thinking about hospital waiting lists, about people, you know, needing hip replacements and knee things, and, you know, getting people through A&E and making that manageable. So I think actually there's a big conversation to be had about what recovery means in the social care context. In a way, you know, the National Care Service plans ought to be addressing that. But like you, I think it's going to be an ongoing process. We are going to be in constant recovery. There's always going to be challenges that come in at it. What I really want to hear is fresh thinking, not only about what recovery would feel like from your perspective, but also how do we get there? What do we have to do to get there? And forgive me, but, you know, being a journalist is about trying to analyze things and boil them down to find the core ingredients. And without the involvement of people directly affected at all levels and at all times in this, you're missing one of the big planks that would make it happen. So I think that's the first thing I would do, to ensure that recovery actually meant something and didn't just become another of those words that gets mashed and abused by these systems and ends up meaning nothing.
Thanks, Pennie. I'm seeing a comment from Tracy coming in there about recovery, and I think that's so important, your comment about bringing all these people together. It's all the skills and the knowledge we've got, but Tracy's saying we need to include mitigating the impact of how poor services were pre-pandemic. And it wasn't, you know, the pandemic has made things worse for many, and Lorraine's saying about, you know, services have stopped and still not restarted for some people. So there's a bit of getting through that almost to get back to where we were at, isn't there?
Well, there's going to be a political temptation, isn't there, to hang everything on the pandemic, and it behoves the rest of us to carry on reminding people that this system was badly broken before the pandemic hit. We are sorting out historical problems that relate to lack of focus, a lack of resource, lack of attention. You know, we heard that confessed during in the early days of COVID, that people didn't know enough about social care to know what the impact was going to be. I paraphrase. But yeah, I think, you know, one of the really big ways that you could mark that you're thinking about this differently and you're going to do this differently is to address the issue of pay, is to pay care workers properly. And yes, I hear, I didn't know that, you know, there wasn't different grading for different levels of skill in those professions. But that would be the, imagine if you were able to say, right, okay, we're drawing a line under the past. This is where we start moving forward. We're going to pay people properly. Folk would sit up and listen and join forces and believe. And that word that was used earlier, trust, would build it or start to build it.
Thank you. I'm listening and reading at the same time. There's you've got a bit of job creation and maybe creating some of your t-shirts.
I'll get printing.
There's an activity. And a good question, says Gordon, is recovery going back to where we were at? Is that what we want? I think we've heard it's not what we want. We want more. And I like that idea, Pennie, of could we forget about all the barriers and create what is it we want to create? But someone's saying, you know, the lack of seats at the table or decision-making spaces. We need to do that as well. And I think for me, there's something about, you know, politely when you get invited to something, making sure you're not there as a token gesture, as a, you know, ticking the box for bringing your expertise or the lived experience. It's saying we want more than that. I wonder if enough of us did that.
So we need to measure then that people, how would you demonstrate genuine involvement, right? Rather than being a tick box. You know, it comes back to some of this academic research that I think needs commissioning, although from the comments, there's a lot of people already working on bits of it, but, you know, I'd like it pulled together and done in tabloid terms, please. I think very much that there's so much that can be done to kind of understand what we don't know and how you would really gauge that involvement is real is a big challenge, and one that I think we need to address. But, you know, when it comes to consultation and involvement, I was involved in, this was before the last election in Scotland, the Scottish government and COSLA came together to draw up consultation and involvement guidance for all the public bodies. Have a look at it, because it's really quite a powerful tool potentially, and might give people a way of getting into the system. So it's called Planning with People. I don't have it to hand to put in a quick link, but it's online. It's not a tough read, and I did my very best to make sure that jargon didn't get into it at all. All right, so I'd be really interested to hear what you think, but potentially that gives some indications of ways that you can go forward. Be interesting to see how it works.
Thank you. We will get that and share it. Thanks very much. Yeah, and Jenna is saying, I think this is Jenna, our new colleague. Welcome, Jenna. Jenna saying meaningful involvement, yes. Training for staff and volunteers and this across the boards would be great. So we've definitely picked out a theme as we're coming to a close, actually, about training, about skills, about, it might not even be that people don't have the skills, but as you said earlier, Pennie, it's about the confidence building and bringing us all together. If there's enough of a voice, enough strength in numbers. Yeah, so quite a few things for us to think about, Lynn, for future events. Absolutely. And maybe taking us into our next discussion about the voluntary sector health and social care network. I can't believe we're at 3 o'clock, Pennie. Thank you so much.
Myself there. Do you want me to go, or?
Oh no, we'd love you to stay if that's okay.
I'm happy to stay. I'd love to hear.
Oh, thank you so much for being with us, for being on the other side. My nerves are gone having to think about questions for you.
Oh no, thank you. It's been great.
Thank you so much for everyone. There's some really great comments, suggestions, things for us to think about. And as I said earlier, really appreciate that we've got a mix of our across sectors in this conversation, because that's really what it's about, bringing us all together to create some change. So thank you, everyone.